Hi, my name is Haley. I just finished the 4th grade. Last week I had surgery. My mom told me I'd have to go to the Children's Surgery Center at UC Davis Children's Hospital. I had a lot of questions. Are you going to the hospital too? Maybe you're having a surgery or a procedure. Let me share with you what it was like for me when I had my surgery. When I woke up on the morning of my surgery, I couldn't eat breakfast. My doctor told my mom this was important to help keep me safe during my surgery. That was hard because my stomach was hungry. When we got to the hospital, we took an elevator to the 2nd floor and checked in at the reception desk. There they gave my mom a bracelet with my name and other important information on it, like my birthday. My mom and I waited in the waiting room until it was my turn to go to the pre-op area. A nurse called my name and walked my mom and me up to the 3rd floor. My favorite part was the circle lights on the way to the elevator. In the pre-op area, the nurse checked my height, how much I weigh, and took my temperature. The nurse showed me to a bed where I would wait until my surgery. Then they asked me some questions and put on my name bands. Then the nurse asked me to put on hospital pajamas. My mom and I put all of my clothes into a bag and kept everything together until I went home. Next, the nurse checked my breathing. She placed a sticky sensor that looked like a Band-Aid on my finger called a pulse oximeter. It had a red light. I was able to see my oxygen level and heart rate on the monitor. The nurse also checked my blood pressure. She put the cuff around my arm. It gave my arm a squeeze. The nurse also used a stethoscope to listen to my heart. Another person I met in the pre-op area was a child life specialist. She showed me pictures of the rooms, equipment, and people I would meet in the Children's Surgery Center, so I knew what to expect. She said that there are 2 ways to fall asleep from anesthesia. One way is breathing it through a mask, and the other is getting it through a medicine straw called an IV. She also said the sleep during a surgery is different than the sleep we do at night. While I waited, she gave me choices of activities to do to pass the time. She brought markers to my bed for me. I met the people who would take care of me during my surgery in the operating room. All of these people make up the surgery team. The operating room nurse also wanted to see my bracelet and asked more questions to get to know me better. Another person I met was the anesthesiologist. This is the doctor that gave me medicine to help me sleep during my surgery. They told me the sleep medicine is called anesthesia. My mom and the doctor talked and together made a plan for me. I used the mask. I learned that when I breathed through it, the anesthesia would keep my body asleep so I wouldn't feel anything during my surgery. I also saw my doctor again that morning. He talked with my mom and me and asked if we had any other questions about my surgery. Some kids drink medicine before they go into surgery. The medicine can help you relax. You can drink the medicine from a cup or squirt it into your mouth from a syringe. I chose a cup. When it was time for me to go to the surgery room, I rode on the bed while the anesthesiologist pushed it down the hallway. On the way, we followed the river lights. In the operating room, the first thing I noticed was the big lights on the ceiling. I looked around the room and saw different machines. I learned how my surgery team uses these machines to help take good care of me during my surgery. They helped me move from the bed on wheels to the bed in the surgery room. This bed was smaller than the one on wheels. It had a seatbelt to keep me safe during my surgery. They put the blood pressure cuff and pulse oximeter back on me. Then they put 3 stickers on my chest to watch my heartbeat. They were cold and sticky. They even gave me a warm blanket. Everyone looked a little different with their hat and mask on, but I could tell that they were smiling and ready to take great care of me. Then it was time for me to breathe the medicine through the mask, and I drifted off to sleep. When I was sleeping, my team placed a medicine straw that went into my vein called an IV. They used the IV to give me medicine. When my surgery was finished, I stopped getting the anesthesia medicine and the surgery team brought me to the recovery room. My family was there with me in the recovery room. I noticed the IV on the back of my hand. When I was awake enough, my nurse asked me if I wanted some juice or a popsicle. The anesthesiologist gave me medicine so I would not have too much pain. In the recovery room, the nurses had more medicine than they could give me if I needed it for pain. Soon, it was time for me to go home. The nurse took out my IV and put a Band-Aid on my hand. It was easier than I expected. All I felt was the tape being taken off slowly. If your doctor decides you have to spend the night in the hospital, the IV will stay in so you can get the medicine you need until it's time to go home. The room you will stay in even has a place for a family member to sleep in your room. I was able to go home after my surgery. When it was time for me to leave, I rode in a wheelchair to my car. Thanks for listening to my surgery story. I hope this makes you feel more prepared to come to UC Davis Children's Surgery Center for your surgery or procedure. And remember, if you have any questions, just ask. Everyone is happy to help.